I see a red light. Oh, I hope I'm on the air. Hi boys and girls, it's me Butch. My name is Terry David Silvercloud. Do a search, I'm out there. So I'm 74 years old. I live in Vancouver, British Columbia. Today's the 3rd of February, if I didn't say that already. It's getting brighter, it's windy and chilly, and we had a touch of snow. It's been a mild winter. Oops. Pop. Well, that wasn't expected. So today I'm here to talk to you about leg sores and what I'm doing to treat mine, which seems to be having some success. So I'm going to be giving you my opinion about something that might work for you. And because it's a kind of a medical kind of thing, you're following my advice at your own risk. So if you think anything I say is bullshit, well, check with your family doctor first. But I can't imagine, and I'm a physicist, how this could do you any harm unless you have extremely sensitive skin. For those of you who are immune suppressed, you should consult your doctor too. So leg sores, they come usually in old age, mostly, and primarily because of poor blood circulation below the knee. And that's sort of the physical reason. And often they don't heal, and there can be a number of reasons. And a lot of it deals with certain types of bacteria that are hard to kill, and even if you kill them, they come back or something. But there isn't a lot of treatments out there other than trying to improve your health. You can do things to improve the circulation in your legs by elevating them in hot baths and maybe some of those electrical stimulator kind of things you can get. I'm poor, I've never tried them out. But I'm going to give you quickly my story. So I'm 74, and about 12 to 13 years ago I rapidly developed a host of skin issues, unusual skin rashes and blemishes, and I became mostly sexually impotent, and I began losing the hair on my legs. So I didn't get much help with the skin blemishes other than, some steroid cream, which didn't do anything, really. Wasn't all that helpful in any particular way. And the response from my doctor at the time basically is you're getting old and get used to it, and maybe extra magnesium in your diet. I was just looking out through the alley there. Might help, but no particular help. So I was also developing severe pain issues, and the pain issues became more dramatic in my life than my hair loss issues and the sores on my legs, which are all rather embarrassing. You'll know if you have them. But eventually I got into pain management, and a new doctor. Finally had a doctor who I really like. I've been with nearly 7 years now. And I asked him if I should be growing because I'd been gaining weight very rapidly. And I didn't quite understand what was going on. And I had had other symptoms that I hadn't thought about, like that I can't get shoes that fit anymore. Why can I no longer get shoes that fit? My feet were doing weird things. I just was changing shape rapidly. So my doctor said he didn't know what was going on, but he had my hormones tested, and it turned out my major hormones were all a bit abnormal, and he talked me into seeing a specialist. I was so depressed at the time with my aches and pains, I didn't really want to see another doctor, but he talked me into it, and I went into hormone replacement therapy, which has been just awesomely excellent for me. I'm no longer sexually impotent. Most of my skin problems vanished. Not totally, I still get the odd zit of one on my nose, but I'm using what I'm going to tell you about on my nose now, and it seems to be helping on my nose as well as on my leg sore, which is sort of what triggered me onto using it on my legs, was trying it on my nose. anyhow, hormone replacement therapy really did wonders for me. It can be, leg sores are often in people who have weight issues or are diabetic, and steroid treatments can be risky if you are overweight and stuff. So, but anyhow, if you do have leg sores and you haven't had your hormones tested, especially if you're male, I strongly suggest you get your growth hormones and your testosterone levels tested. And there's two types of tests. So you want every testosterone test there is, and are you normal or abnormal? And I have to do dalatestrol. Other brands don't work that well on me, but once I found dalatestrol in the right dosage, it's been a miracle in my life. It keeps me getting up in the morning. I live alone, and if you're old, which many of you probably are, and I'm a social recluse. I'm not a Sheldon Cooper, but I'm one of those intellectual types, and I find most people are just, I don't even know where they're coming from. Let's not get into that. I don't want to sound insulting. People think well, what kind of a-hole are you? I'm just somebody who knows a lot about everything. So, because I've yacked up to 6 minutes here already, I gave you my background. So I had after I had the hormone replacement therapy started, all the lesions on both legs and my skin problems I was having around my ears, and especially around my ears and on my chest and in my pubic hair area. I was having a lot of lesions in my pubic hair area. Hairs just stopped growing. But once I started the hormone replacement therapy, the hairs, they're all healthy again, and the skin problems are mostly gone. Except a few. Now on my right leg, I'm going to bring the camera down here somewhere, and get you in close here. You can see these purple marks on my legs. So a month ago, these were all pretty much open sores. So I've been treating myself for a month now. This was a really big open sore here. And even after I began treatment, it would scab up, and I would let it scab for a few days, and I would soak it off to make sure the treatment got right down to where it was supposed to. So right now I have only this little sucker right here that's being a bit of a diehard, still scabbing up. But all the others, the scabs are mostly gone, and I have hair, healthy hair on my upper leg here now. I have some conditions down here, which sometimes steroid creams helps this, and just rubbing it to get all those dead blood cells moving down there helps. But this is where I am a month. There's some dry cream on there, and what is it that I'm using? And it is Oxy Deep Pore Acne Treatment, and I'm using it exactly as instructed, at least twice a day. And I get a shower once a day to keep myself clean, and but at least twice a day. What comes in there is this little bottle, and you don't need hardly any of it. You just need a little titch of it, so you can just squeeze a teeny little bit out, and it'll go a long way. And that sucker, and get the ones around it. I have one that's almost gone away back here. You can barely see it anymore. And this sucker up here. Do that a couple times a day, and it recommends that you wash your hands afterwards, because you don't want to get the stuff in your eyes, particularly. That's the big thing, is to make sure you don't get it in your am I there? Are we there yet? So yeah, wash your hands afterwards, otherwise you might get some in your eyes, and just follow the directions, and maybe it'll help you. I don't want to go on and on and on and on and on, and I'm looking at the time. See, nearly 10 minutes I've been yakking. So that's it. I try to be useful in my old age. I know that the world is a hopeless mess. I'm a scientist, and I'm telling you, It ain't good, folks. And what you and I can do basically is to learn more about politics and how we can get the right politicians in there. You know, humans are just greedy, and they think tomorrow's going to be okay, or they're all religious and they think it's all going to be Armageddon anyway. Me, I don't particularly like the world anymore myself. That's why I'm so reclusive. The humans are difficult, for sure. So that's me. That's my treatment. Oxy 5, try it on your leg sores. It might help. Here's my world. You see my world? See if I can see my screen, what I'm actually looking at. There's outdoors today. It's a bit gray out there in the alley. And I'm an artist in my old age. Today I've been working on this experimental thing again, trying to get it done. And trying to get all these landscapes out of the way. So I'm an artist in my old age, and art's a hard sell these days. Painting is not in style. Painting ain't in style anymore. So, am I ready to shut up? Shut up. Check out some of my other videos. You might find them educational. I'm just trying very hard in my old age to be useful, and I thought that, you know, I'm going on 75. I could drop dead tonight. Who knows? That if I don't get it out there, don't get done, you miss every opportunity you don't take. That's the way she goes. So, let's turn my mousy mouse on. My little computer is definitely not well these days, but I hope this video will work, and Butch in Vancouver is going to say bye-bye.